Hi everyone, my name's Holly and I'll be running an education session detailing the effects of nurse to patient ratios on staff and residents in aged care. Currently, there are no specific nurse to patient ratios in aged care. The Aged Care Act 1997 states that as long as there are a number of appropriately skilled staff working that can provide care needs to the residents, then legally that facility is providing safe work practices. This is causing a major disruption to both nurses and residents as care is not being delivered appropriately and staff are being overworked and are underskilled. So, why is this important? It has been proven that there is a correlation between the number of nurses working and patient outcomes. It was found that the number of nurses delivering care was linked with patient mortality, pressure injuries, and hospital admissions. Nurse to patient ratios in aged care are important first and foremost for the safety of both patient and the nurse. Not only is safety important, but delivery of adequate care and holistic care are imperative to ensure the overall well-being of the patient. When nursing ratios are not at a safe level, the delivery of care is not optimal. Thus, these impact both patients and nurses. So, why is this a problem? This is a problem because, as healthcare professionals, nurses are there to assist patients with holistic healing. If nurses are unavailable to maintain a holistic approach to their care due to staffing levels, then they are not carrying out their job requirements and providing adequate care. As said before, this not only impacts the patient or the resident, it impacts the nurse. When ratios are not at an adequate level, there is a higher workload for nurses, which then leads to high stress. Already being known as a high stress job, this can reduce the number of people wanting to become a nurse. This would reduce the number of nurses available while Australia is in a crisis for senior nursing staff. So, what is being done about it? Over the years, there have been many attempts to secure nurse to patient ratios in aged care. There have been many reports supporting evidence that staffing is related directly to adequate patient care. However, there is still no ratio put into place by the federal coalition government. Currently, the Royal Commission is holding public hearings as well as visiting facilities around Australia to collect information to reform Australia's aged care system to ensure optimal care is being delivered. A final report will be completed by April 2020, detailing the findings and hopefully will create change within the healthcare industry. How can leadership contribute to resolving or mitigating the problem? Leadership can help mitigate this contemporary issue by creating a supportive working environment that is focused on teamwork. While having leaders that contribute to this culture, it can be ensured that fellow nurses will feel supported, less stressed, and are more likely to ask for help. Therefore, this can result in reduced number of incidences, while the Royal Commission evaluates the need for increased staff to patient ratios. So, a background. Over the last 13 years, there has been a 400% increase in preventable deaths in aged care, with hundreds of people dying from falls, choking, and suicide. The key word here is preventable. If there were adequate staffing levels, the incidences of these deaths would be significantly reduced. Due to advances in the medical field and technology, humans are living longer than their ancestors. As people are living longer, the demand for nursing care of the elderly increases also. Over the last 20 years, the number of aged care facilities has nearly doubled. However, the laws surrounding staffing levels in facilities has not changed. The big issue is trying to find a skilled aged care workforce that is able to provide holistic care to its residents or patients that have legal patient ratios set up by the federal government. So, some statistics. Between 2015 and 2016, there were 240,000 people admitted into permanent aged care. From 2017 to 2061, the percentage of people over the age of 65 is set to increase to 7%. 1 out of 20 will be over the age of 85. 90% of nurses have stated that they feel they were unable to provide adequate emotional support to their residents. And in 2016, it was noted that registered nurses spent an average of 48 minutes over a 24-hour period per resident. So, what is the impact on the patient? We've got reduced patient satisfaction. It has been proven that staffing ratios directly correlated to a patient's satisfaction. Reduced quality of patient care. So, an integrative review based in aged care homes found that the more registered nurses that were working, the higher quality of care that was provided. This was found through decreased mortality rates, reduced number of unplanned hospital admissions, and a reduced number of pressure areas. There's an increased risk of mortality. A risk assessment has found that the number of patients or residents a nurse has was significantly associated with a patient's mortality. It was found that for every additional patient a nurse has, there is a 5% increase in the odds of that person dying within 30 days. A lack of empathy. So nurses that are time poor must prioritise their care. For example, that means that if there is someone that is due insulin and someone that is feeling upset, their priority is to give insulin as this is a short-term, high-risk situation. If a nurse is time poor, their following priority usually falls to another clinical task. This is proven that when nurses are under time constraint, they are task-orientated and therefore do not assess and care for their patient or resident holistically. So what is the impact on the nurses? Nurses are at high risk of burnout. When nurses have a higher patient load, they are more likely to miss breaks or not take precautions to care for themselves. This leads to an increased risk of nurse burnout, which then goes on to affect residents or patients in ways as said above. High risk of burnout also leads to an increased number of sick calls. An increased number of sick calls will significantly increase the patient to nursing ratio, which then increases the risk further of causing substantial impacts on the patient and the nurse. There's an increased risk of mistakes or incidents. So a study has shown that when nurses are stressed and under pressure, as they are when ratios are high, they are more likely to make mistakes or cut corners. This increased risk to the residents and is directly linked to nurse staffing ratios in aged care. There's reduced job satisfaction. It has been found that when nurses leave work and feel as though they are not making a difference or their actions are not helping their residents in a positive way, their job satisfaction decreases. A decreased job satisfaction then leads to reduced empathy and the mentality of do what I need to do and get out. This mentality is of no benefit to the nurse, to the residents, or to the facility. And there's also a risk of injury. When nurses are under stress and are time poor, there tends to be leniency in making poor decisions to save time. This has been shown repeatedly through a lack of use of slide sheets. This can cause injury to both nurse and resident and is a readily available, easy solution that was not used due to a lack of time. So what is the responsibility of the new graduate nurse and the ethical and legal boundaries? The responsibility of the new graduate nurse is to provide holistic care to their patients while maintaining the standards for practice provided by AHPRA. It is imperative to remain within your scope of practice, and if you feel as though you are unable to do your job without stepping out of these boundaries, it must be reported. If the patient load feels unsafe, again, it is important that it is reported. Follow policies and procedures. It is important for a new graduate to memorize the policies and procedures of the facility they are working at. In relation to staff to patient ratios, it is important to be able to follow policies and procedures while delivering optimal care. The standards of practice and policies and procedures are legal guidelines put into place to ensure care is delivered to all residents. If a nurse does not follow these legal guidelines, there are complications to both their registration and their employment. Non-maleficence is acting in a way that nurses do no harm to patients, and beneficence is the ethical principle based around doing what is best for your patient. These ethical principles are central to the nursing profession and assist to support nurses in providing the best care possible. So why am I presenting this way? I am presenting this to you in a 10-minute PowerPoint as we as nurses are time poor but require ongoing education and CPD points. This topic is central to your practice and important to understand how it can be managed so the best care is provided to the patient and to the nurses.